Good morning.
You're the brains.
You guys ready?
You're the brawn.
Good morning. Thank you all for being here this morning. I'm pleased to be here this morning with delegates Marshall, Nixon, and Hamilton, and many members from the NFIB and the Chamber of Commerce. Good Americans all. Clearly, the repercussions of the current economic recession are reverberating throughout living rooms and boardrooms all across the Commonwealth, as well as committee meeting rooms here in the General Assembly building and on the House and Senate floors. Virginia businesses and families are grappling with tough choices on how to bring their finances into balance. People are worried about keeping jobs and worried about paying their bills. House Republicans understand their difficult times, and we are willing to stand up and try and help them the best way we can. Virginians aren't seeking just our sympathy or empathy. What they're looking for and what we're trying to provide are real solutions to help them overcome these tough financial hurdles and tough financial difficulties they find themselves in. They want representatives in Richmond who are going to work together to produce practical, sensible solutions that deliver real results to address their most pressing issues. And that's why we're here today, to highlight and to discuss House Republican Majority Caucus's package of practical solutions to one of Virginia's most fundamental economic concerns, access to affordable health care. Because too many Virginians are struggling to cover the rising cost of health care for their families and employees, House Republicans have crafted common sense solutions to meet this serious challenge. Over the past several sessions, House Republicans have shown strong and aggressive leadership in developing, advancing, and in enacting reasonable reforms in the area of health care services. For example, we have made the purchase of long-term care insurance more accessible and more affordable. We have strengthened Virginia's critical safety net options. We have made a high priority to protect and help our most vulnerable citizens with mental health concerns, and we've improved the availability and the care offered to our military service members and veterans. In fact, offering innovative and practical solutions to Virginia's challenges is a hallmark of House Republican leadership in the General Assembly. And now, with the Commonwealth confronting the most difficult economic environment in the last 2 decades, it's essential to build and to expand upon our previous accomplishments, providing real results that will further improve the quality of life for all Virginians. This session, our health care package, seeks to address the worries people have about their access to and about the quality and price of health care services. And that is why the innovative approaches that we're championing today will give Virginia's many small businesses the ability to offer affordable health care coverage for all of their employees. Small businesses and startups throughout our Commonwealth have long provided the foundation of prosperity and will undoubtedly be the lifeblood of future economic recovery. Delegate Danny Marshall outlined his bill that will help small businesses remain competitive by allowing them to offer market-based health insurance decisions so they can attract and retain the best and the brightest workers. We also have legislation by Delegate Phil Hamilton that will increase competition for health care, which will result in higher quality services and greater access and affordability. And House Republicans, again, are helping to make it possible for Virginia to take major steps forward to further incorporate 21st century technology into our Commonwealth's medical care so that errors are reduced and that lives are saved. Delegate Sam Nixon will discuss his bill to better ensure that.
Good morning. House Bill 2024. Virginia has legislated health insurance policies that are unaffordable. Health insurance coverage is financially out of the reach for many lower income workers. In Virginia, we have over 1 million citizens that do not have health insurance, and one of the main reasons is cost. House Bill 2024 will provide an opportunity to increase the number of individuals with health insurance.
I'm here to talk about House Bill 1598, which was related to the Certificate of Public Need. That's a very complex law in Virginia, so I'll try to break it down as simply as I can. Healthcare providers that want to either build new healthcare facilities or offer new services have to get permission from the state and demonstrate that there's a need for this facility or this service to be offered. And House Bill 1598 seeks to streamline that process Current law has 21 criteria that the Commissioner of Health
and a decrease in number of uninsured.
is supposed to examine in looking at these applications. In talking with the Commissioner and the administration, they readily acknowledge that there's only a few of those criteria that they actually focus on. So what we did this year is we introduced legislation that reduces the number of criteria to be considered from 21 down to 8. And those 8 criteria focus on increased access to care, affordability, institutional competition. And those are critical to providing services to the citizens that we seek to serve. In addition to that, there's an expedited process for the conversion to psychiatric beds. The growing demand for community-based services within our mental health system requires the ability of the industry to move more quickly to create those facilities for psychiatric beds across the Commonwealth. And as Delegate Marshall mentioned earlier, there is also the provision where hospital systems can account their charity care and their services to the indigent and meeting the financial obligations related to the Certificate of Need purpose. With that, I'll turn it over to Delegate Nixon.
At the forefront of health information technology for several years. Some of you may know that the Joint Commission on Technology and Science formed an advisory committee about 3 years ago to specifically study this issue. And we adopted one of the nation's first ever requirements that state governments, to the extent possible, require that any system that involves health care adhere to the national standards for health interoperability. This year's bill, House Bill 2044, is actually a collaboration.
But Bob, let me address that in some respects. Don't forget what we did last year. We made a significant investment in the free clinics and the community health centers because we were starting to see more and more individuals in the situation that you've described. And we made an investment in that safety net last year. And it is our intention to protect that safety net as best we can. Other thoughts? Let me address that in some respects. Don't forget what we did last year. We made a significant investment in the free clinics and the community health centers because we were starting to see more and more individuals in the situation that you've described. And we made an investment in that safety net last year. And it is our intention to protect that safety net as best we can. Other thoughts?